Hi, this is Carmen Enoh. I'm a student pharmacist, and I am going to be giving you some information about the medication loperamide. Loperamide is found as Imodium or diamond over the counter, and this medication is an anti-diarrheal. I am going to give you information about all formulations of this medication. This is used to treat diarrhea or to lower ostomy outputs. How should you use this medication? If you are using this medication over the counter, read all the direction on the product label. If this is prescribed by your doctor, follow his recommendation. For all products, you may take the medication with or without food. However, for the chewable tablets, it is better to take it on an empty stomach and chew the medication thoroughly before you swallow it. Drinks a lot of non-caffeine liquids unless you are told to drink less liquid by your doctor. Example of non-caffeine liquids are water or even juices. For all the liquid products, you want to make sure you measure the liquid doses carefully using a measuring device that usually comes with the drug. But if there's no measuring device, you may ask your pharmacist about one. For the suspension, you want to make sure to shake well the medication before you use it. Take the medication by mouth, usually after each loose stool. If this is a medication that you take over the counter, after each loose stool, you may take the medication. But if this is prescribed by your doctor, you may use the medication as directed by your doctor. For children, the dosage of the medication is also based on the age and the weight. For adults, you should not use more than 8 milligram every 24 hours, which is 1 day. So no more than 8 milligrams per day or no more than 16 milligrams per day if this is under the doctor's direction. For the rapid for the rapid dissolving tablets, you want to make sure you dry your hands before opening the blister to avoid making the blister dissolve with your wet hands. So make sure you dry your hands before you open the blister containing the medication and carefully remove the tablet. Place the tablet under your tongue and allow it to dissolve completely, then swallow it with your saliva. So you do not need to swallow it with water, just with your saliva under your tongue. Remember to drink a lot of fluids to replace the loss that might have been caused by the diarrhea that you are experimenting. And with the diarrhea, you can have dehydration. So that's why it's important to replace the loss of fluid with water, for example. Sign of dehydration might be extreme thirst, decrease in urination, muscle cramps, weakness, or fainting. So if you experiment any of these, you may want to hydrate yourself with, for example, water. Most of the time, this drug is taken on an as needed basis. So do not exceed the recommendation. And if it is prescribed by your doctor, do not take more than your doctor told you to. Some side effects that you may have with the medication are dizziness, feeling of being sleepy, feeling tired, or weak. What should you tell your healthcare provider before taking this medication? Well, before taking this medication, you want to inform your prescriber about any allergies that you may have to loperamide or any other drugs or foods. Tell your doctor if you have belly pain without diarrhea, dysentery, which is blood in your stool, and fever, constipation, colitis, which is a bowel problem. Also tell your doctor if you have lung QT on an ECG or abnormal heartbeats or any heart issues. You may also inform your healthcare provider if you are breastfeeding. It is really important to avoid using this medication when you are breastfeeding. To store this medication, you may store this medication at room temperature, protected from the light, in a dry place, and do not store it in the bathroom. Also tell your doctor if your diarrhea does not improve after 2 days, and if it gets worse, or if you have blood in your stool. If at any time you have a question about the medication or your treatment, you may call your pharmacist or your doctor. Thank you.